If you're experiencing sciatic pain, we're going to explain to you what is a very likely cause of this, how to release that area, and then strengthen your body into correct alignment to prevent sciatic pain.
So the sciatic nerve runs directly underneath the piriformis muscle for the majority of people, and actually through the piriformis for some people.
And that's a deep muscle in the butt.
It's the deepest muscle in the butt, yeah. So to get to this area and release it, it's a hard thing to do. First of all, though, let's talk about what's causing it in the first place. So Quinn, if you can stand up. So typically, if you can actually get into incorrect alignment, so we can just discuss what's happening over time. So now, right now, we can see that Quinn has more pressure on the left leg, and the right leg is pulling away from the body. And this would be indicative of sciatic pain, probably more in the left side, because as that right side pulls away, it's acting like a flat tire, drawing everything from that left side into that system. So that left glute ends up under tension, putting more pressure on that sciatic nerve. So the first thing that we want to do is we want to correct our stance. We want to make sure that we are appreciating proper foundations, having the feet directly under the hip joints, knees slightly bent, kneecaps over the second toe, and we want to connect to that rooting action, squeezing the anus, so that we can bring 60% of our body weight onto our heels. Standing this way all the time takes away the need for either side to develop adhesions, because now we're balanced in our own body. But if you do have pain in one side, we're going to show you a position now that you can use to really help with this situation.
Awesome. So this is the piriformis position, of course, and again, right in the middle of the butt. So if you have your block buddy, awesome. If you don't have a block, you can use the rolled up towel as a prop. I'll start off with this, and then I'm going to swap to the block. All we're going to do to start is just lay flat on your back, and I'm going to be doing the right side. Again, whatever side the pain is located is the position you're going to be doing, the side you're going to be doing. So all you're going to do is lift the pelvis up and then position the towel or prop in the middle of your glute. Now you're going to see and feel your sit bone, which is a bone pretty well in the middle of the glute. You're going to have the towel just above that bone, and you'll probably be able to feel the piriformis. I can already feel pain. I'm going to keep my left leg bent, my right leg straight, and then we're just going to start off here.
And as always, it's really important that we connect to that proper diaphragmatic breath, so you can have your hands on your belly, which gives you a nice prop to make sure that the breath is coming from the belly. As you inhale, the belly should rise toward the ceiling. Exhale, it should fall back down. And then the goal here is we want to stay for a minimum of 3 minutes, because again, we have to go through the gluteal muscles and the piriformis to get to that sciatic nerve. So there's layers and layers of muscle and confusion and adhesion. So you can stay as long as it feels good, but for sure a minimum of 3 minutes to really have an effect. Now, as a therapist working in this area, it's very hard to get through that tissue, but simply lying here on something, you can spend the time that you need and use your body weight and gravity to your advantage. And then you can even search for pain by turning the foot in or out, moving the leg out to the side, lifting the leg up off the floor. Basically, you're searching for pain. You want to become a pain seeker, because pain is where the adhesions are. And that's what our goal is, to melt through those adhesions so that we can get to the next layer of adhesions and melt through those. It's pretty much a never-ending process, but each time you go through layers, you improve in your alignment and you improve in general in your fascia flow. How's that feeling?
Really good.
Wonderful. And it is lovely. If you have a lot of tension in your back even, this is a lovely position to just bring calm into your body. And you can do this in bed too, and spend, again, as long as you want. I'll sometimes spend up to 30 minutes in one position if it feels right.
And then to get out of this position, let's bend both of the legs, and then exhale, connect the root, lift the pelvis up, take the prop out, pelvis back down to the floor. Always roll over to one side as you're getting up.
And then just to add,
that's that.
When you're seated, whether you're sitting on a floor, sitting on a chair, we want to bring balance into our seated alignment as well. So take note of those sit bones, those bones that you feel on the floor, and then you want to feel that there's equal weight on both sides. If you really pay attention, you'll probably feel you have a little more weight on one side than the other. So just something else to bring into your awareness to help with the situation.
Perfect. Okay, so that's everything for this video. If you liked it, give it a thumbs up. If you have any questions or comments, leave them down below and we will answer. And subscribe to the channel and make sure that you hit the bell if you want to be notified when we upload videos like this to really help getting your body on track. We'll see you next time.